Reserve, a veteran of Operation Desert Storm. I want to know how many veterans are in the audience? 2. What service, sir?
Navy.
Go Navy! Go Navy! This gentleman is a Korean War veteran. Sir?
Army.
It's okay. I just have a prejudice about the Navy. There's no Marines. Where's my Marines? Air Force, Coast Guard, Reserves. Okay.
Marines are under the Navy anyway.
2 years of Camp Lejeune. I know better, okay?
I was a house corpsman.
Oh, you were a corpsman?
With the Marines.
Ah, you're a corpsman in the Marines?
I was.
Well, you was? All right, everybody needs to pay a little respect for this gentleman over here. This talk is geared and going to be presented for Navy corpsmen, field corpsmen, medics, SEALs, Special Forces, nurses, Navy nurses, PTs, and PAs, all of who work with trauma in the military. So now the rest of you are civilians. So guess what? We're going to go to Camp Lejeune, North Carolina, and you're going to go to basic training. And I'm going to be your drill instructor called the DI, because you got to learn something about the military culture, because the military doesn't see PTSD the way the rest of the world does. My talk is the go-go combat stress reaction, which is a stimulus-triggered response, hypersympathetic PTSD to the extreme. It was treated in 60 minutes using frequency-specific microcurrent. I call it the STAR units, in for STAR, three protocols, the muscle go-go, the betrayal go-go, and the concussion go-go. You wrap the units around the wrist, and you turn the current on, and you run at 400 microamps, all 3 units at the same time. The second treatment is called MASERs, which is military grade, bimanual, bilateral, 24-point meridian tapping. This is a combination frequency. This is not a plug-and-play experience. You have serious PTSD going on, and you have to actively engage with the physical part of the body. Flip it. Oh boy, I got a medic there. God, jeez. Whew. I'm sorry. When you're going to go to basic training, you're going to get your DI. Your DI is going to teach you you're going to take 18-year-old kids, and he's going to train them to become Marines, killers. And he does that by drilling muscle exercises into them until every possible experience that they could encounter in the battle has been given into muscle memory. That's how the soldiers work, muscle memory. So he does drill until they create a skill. And if their skill level is good enough, then they can go on to the next drill. So we do drill, skill, so they can kill, because that's what warriors do to protect us. But not only does the drill instructor teach them to be good warriors, he teaches them how to get themselves and their team back to the base alive. The drill instructor uses these behaviors to generate muscle memory. The muscle memory is implanted on the cells of the muscles so that it's there to be used at all times. I don't know if you can see this very good. This is a lamb chop from my kitchen. Right there is the myofascial tissue, and there's some more over here. And Jim Osman calls that the extracellular matrix conduction system. And through that go the meridian. The meridians are, conduction pathways from the fingers and the chakras, and they travel through your body, and they are hardwired to the cells. The advantage of using the meridian system when you're in battle is that the speed of information data transfer is at 186,272.4 miles per second. Or if you're doing phonons, it's 1,600 miles per second, as opposed to the femoral nerve, which only transfers information at 180 meters per second. So if you want to be in battle and get the hell out of the way, you're going to use your meridian system. Next slide, please. Oh, God. I got to. This man's got your back. Let me tell you, wherever you go, you got a field corpsman that gets your back. This is the lesion. Can you see that? This is the lesion of PTSD. It took the cellular biologist to get an electron microscope to find this. All that is a cell right in there, and all those little hairy things are the trauma that's recorded in the microtubules at the time of the traumatic incident. This is an acute cell with acute PTSD. This is a chronic one where the microtubules have sort of organized. Now, it was one of the greatest joys of my life in 2006 when Bruce Lipton presented for me and everybody else his experiment where he took happy little cells and put them in a petri dish, exposed them to fear, and lo and behold, microtubules grew on those cells. He repeated this finding in the lab. And not only was that wonderful for me because it's a pathological diagnosis, and gynecological surgeons love pathology and love slides, would like to see what we're treating. But it also defined for me the mechanism of how this works. But more than that, so how are you going to treat it? If the bad energy comes in and creates all this stuff, then I, as a laser surgeon, CO2 laser, neodymium YAG laser, I love to shoot lasers around and point energy and blow things out of the way. So I knew that there was a way to get, next slide please, sir. I knew that there was a way to get this out. This is Hameroff. Hameroff is a professor of anesthesiology. He's been working with microtubule research since 1993. And this is his most recent paper, and it is extremely complete, and it will put you to sleep, unless you love this kind of stuff. The important thing is this is a resting cell, which has the microtubules collapsed right here. And when the stimulus trigger comes in, all of those microtubules get into that position, and they are firing. This is the pre-moon time to send I'm doing it right now. I'm buzzing off those microtubules. And when you do this, when you see this in the lab, it looks like there's been a big, huge floral firework that has exploded, and all the little pieces come off. And that's what happens to these microtubules if you attack them during the acute process, whether it's a panic attack, or like that lady who was having a panic attack about her abusive foot trauma from the operating room. Okay, next slide, please. All right, now I want you to get to your handout. I want you to go to page 4 of the handout with the Marines picture at the top. And I want your assignment is to read this sometime, not now. I'm going to define for you what the Marines would call the Gogol comment stress reaction. It's all about the muscles. The first thing that happens is you get the 1,000-yard stare. The eye muscles are affected. You get throat gets affected. You have a monotone voice and can't talk very well. Then you have all the muscles in your chest, all the muscles in your arms, and in fact, all the muscles in your body expanded with what I call brawny edema. You can feel it on their chest wall. Then you also have all the muscles having their memory responding to this so that the muscles are already moving to get out of the way of problems caused by the trauma trigger, and they're moving. There is no connection between what the muscles are doing right here and now and the prefrontal cortex control of the body. The muscles are reacting what happened in the past right now. It's cellular memory. Okay, now I need so you are now all official privates in my company, in my platoon. I need a male volunteer to be the gunny sergeant, who is an E7, that's high up there, Who's got the go-go combat stress reaction? I'm going to be tapping on your chest. I'm going to be tapping on your face. I'm going to be tapping on your hands. I need a male volunteer, please. Don't all volunteer at the same time or I'll have to pick somebody. Private. Private. What is your name, please?
Gordon. Gary Gordon.
Gary Gordon. Private Gordon. Excellent. This is excellent. Would you please think of some traumatic processes going on in your body, tennis elbow, something that you don't like. And on a scale of 0 to 10, I want it to be like about a 5. And the entire time that I am working on you, I want you to be focused on your problem. Okay? Okay, now let's pull out our masers. Everybody pull out your masers. This is a drill. Everybody pulls out your masers. All right, the maser has a barrel where you shoot the electrons out, 2 fingers, and it has a grip in it, okay? So you pull out your masers. Hey, in the corner, there's no, that's it, good, okay, we got it. Great. All right, so now we're gonna ground ourselves. We're gonna focus. We're gonna focus our intent on what is the highest good for the gunny sergeant. What is the highest good? What is the highest good? And you keep that in your mind the entire time. This is deadly serious. All right, now you ready? Got your masers? God, you guys have got to get a little bit better. You know, you got to repeat this a couple more times. Before you can shoot, what do you have to do? You're not participating. Okay. You have to load your gun. You can't shoot unless you've got rounds in your gun. So it's either 7 or 15 or 21, no matter how many you want to put in there. And the point of loading your gun really is, because this is the small intestine meridian, and this is 3, 4, and 5, and when you tap on there, you stimulate the parasympathetic system. So what you want to do before you start is you want to control your own heart rate, because you don't want to be out there messing around when you're trying to treat somebody, okay? So this is calming yourself. Okay, so now, we're going to start the treatment. They just brought the gunny sergeant to me. The MPs brought him. They found him walking around. They got his rifle. And so now I can treat him because he doesn't have a weapon. And he's been at this for probably 12 hours. I say, Gunny, I heard you got the go-go. Mm-hmm. That's good. That's really good. I'm going to help treat you for that. Is it all right if I hold your hand?
Fantastic.
Okay. And I'm going to tap on here. Gunny, and this is Chinese medicine. And don't ask me about this Chinese medicine stuff. All I know is it calms your heart down. And so we want to calm your heart down so you get that under control a little bit better, okay? And now I want you to put your hands together in a prayer position, because this is going to make things go a little bit faster, Gunny. And you're going to say to him, you're safe, you're strong, you're smart. 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 You're going to say this in a field command voice. These muscles memorized the field command drill DI, yelling at them. So that when I start yelling at him, those muscles are going to respond to that tone of voice. You're safe, you're strong, you're smart. Now I'm going to do your sides. You're safe, you're strong, you're smart. You're safe, you're strong, this is liver. Safe, you're strong, you're smart, this is kidney. You're safe, you're strong, you're smart, this is chin. You're safe, you're strong, you're smart. 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 And now I'm going to teach you how to do, flip the next slide, please. This is the United States Navy SEAL box breathing technique. Each side of the box is supposed to be equal time duration. The goal is to get it up to 10 seconds on each side. And you take your big breath. Your breath, hold, big, big, bigger. Hold it, 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 hold it. Exhale. Exhale profoundly. Hold it, 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 hold it. Inhale. Profoundly. Hold it, 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 hold it. Exhale profoundly. Now, that's very good. Now, when he's doing the Navy SEAL box breathing, I'm going to be tapping on his lung meridians, okay? Now we're going to go right back on into the next sequence, and these sequences are listed in the first part of your page 1 and page 2. And this is the time and orientation. This is October. This is October 2015. This is Carefree, Arizona, Carefree, Arizona, Carefree, Arizona. October 2015, October 2015. 10-10-2015, 10-10-2015. That's the spleen, I'm a little bit low. This is the liver. October 10, 2015, the Carefree Conference, Carefree Conference, Carefree Conference, the Carefree Conference, October 2015, October 2015, October 2015. I need to have you do box breathing. In, hold it, hold it, hold it. Out, let it go. October 10th, 2015. Okay, now we're going to go on to the next step. I want you to turn a little bit this way. And we're going to do, with your eyes open, we're going to do, we're going to work on your eye muscles to get those to relax a little bit, Gunny. So I'm going to tap right here. And I want you to follow my fingers with your eyes. And I'm doing a lazy 8. Safe, you're safe, you're safe, you're safe, you're safe. Don't move your head. Near, far. You're safe, you're safe, you're safe. Near. All right, we're going to do another lazy 8. You're safe, you're safe, you're safe, you're safe, you're safe, you're safe, you're safe. You want to make certain you're checking those eyes. You're safe, you're safe, you're safe. Near, Gunny. Far, Gunny. Near. Now, when I'm doing that, I'm checking to see the pupils constrict and dilate. The muscles, the eye muscles come together and diverge, so that we're seeing that. We're also watching to see if there's any twitters around in there, and if you have a twitter, like over here, then you switch over to tapping until you tap the twitter out. That twitter is the angle of incidence of the oncoming projectile or whatever was coming at him when he was traumatized. So you want to get rid of those traumatizations. So then we go, you're safe, 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 you're safe. You're safe, 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 safe. One more box breathing. Hold it, hold it, hold it, and let it out. He is really good. Hold it, 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 hold it. All right, so now we got the eyes taken care of. So now we want to go on to the muscles, in the general muscles. Now, Gunny, I want you to close your eyes, and I want you to go back to when this happened. And I want you to remember every smell, sight, everything that you can possibly remember that was sensory involved with this. And you're safe. You're safe. You're here with me, and you're totally safe. You're safe. You're safe. You're safe. You're safe. You're safe. You're safe. Large intestines, lungs. You're safe. You're safe. You're safe. You're safe. Spleen, kidney. You're safe. You're safe. You're safe. You're safe. You're smart, and you're strong. You're safe. You're safe. You're safe. You're safe. And so you're safe, 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 and you go through that. And now, Gunny, keep your eyes closed, but it would be really helpful if you could tell me what went on during this, because the more you can talk about it right now, the more we can knock the memory off. So you're safe, you're safe, you're safe, you're safe. So Gunny doesn't know the story, but I'm going to tell you the story. The Gunny was over in Fallujah, and it was their first deployment, and he was point on the patrol. You know, point is the lead person. Okay. So he's walking along, and all of a sudden there's an explosion, and he gets pushed forward, picks up his rifle, and he goes, "No! Max, no! No, Max!" Max is his battle buddy, and his battle buddy has just been blown to smithereens by the IED. And the smell of the blood is overwhelming, but he looks over, and there's the medic, and the medic is bleeding. So he takes the pack, the dressing pack, and pushes it on the medic, and stops the bleeding, and he waits for the chopper to dust down. And they come over and they get the medic, and the medic gets back to the hospital. The medic is just fine, but the private is stopping the bleeding. So then he has to go and pick up Max. Oh, I killed you. I should have died. I killed you. He picked up Max's body and took it back over the rotor, and then he came back more and got the legs and the arm and took it back over there. And then ever since then, he's been not able to sleep at night because he's thinking about Max. Max was, not only was they were battle buddies from basic training, and he knew that he was responsible for Max's death. So while he's telling me the story, I'm tapping on him. I'm still tapping on him because I want to knock those tubes out when he's telling it, because he's really involved with the story. And wait a second. So then I ask him, after I get him to calm down a little bit with the tapping, "You're safe, you're safe, you're safe," I ask him, "Has Max ever come back to you in a dream?" And normal. And he said, "Well, yeah, once." I said, "That's good, because Max has come back because he's telling you he's got your back. Max has got your back, man. He's here. And Max damn well knows he wasn't following in your footprints. He was off to the side, and that's where he got killed. It wasn't your fault. It wasn't your fault. Max is your buddy, and he loves you, and he loves you, and he's got your back. He's got your back. Max has got your back forever. Max is back. He's got your back. Now we're going to go. All right, box breathing, please. Hold it, hold it, hold it, hold it. Exhale. Good job. Hold it, hold it, hold it, hold it. Max got your back. Max got your back. Max got your back. So now, after this, there's a whole lot of physical release that was going on with that. So you can feel his muscles on his arms and his chest, and they're all soft. All of that trauma stuff is like evaporated. So it's okay now to go on to the next step of the treatment protocol, and that is the protection phase. And now you can either keep your eyes open or you can keep them closed. We're going to tap, you're loved, nurtured, protected, empowered, forgiven, and healed. Forgiven and healed. You're loved, nurtured, protected, empowered, forgiven, and healed. Forgiven and healed. Forgiven and healed. You're loved, nurtured, protected, empowered, forgiven, and healed. Love, nurtured, protected, empowered, forgiven, and healed. You're loved, nurtured, protected, empowered, forgiven, and healed. Love, nurtured, protected, empowered, forgiven, and healed. Love, nurtured, protected, empowered, forgiven, and healed. You're loved, nurtured, protected, empowered, forgiven, and healed. Box breathing. You're loved, nurtured, box breathing. You're loved, nurtured, protected, empowered, forgiven, and healed. You're forgiven and you're healed. And then the last step is the step, and you can open your eyes if you want to, or you can leave them closed. Everybody smile, please. Everyone smile. You should be tapping now. This is a good chance to tap. You are, I have muscle memory without connection to the prefrontal cortex. You're safe, you're smart, you're strong, and you're smiling. You're safe, you're strong, you're smart, and you're smiling. You're safe, you're strong, you're smart, and you're smiling. You're safe, you're strong, you're smart, and you're smiling. You're safe, you're strong, you're smart. You're safe, you're strong, you're smart, and you're smiling. You're safe, you're strong, you're smart, and you're smiling. And you're safe, you're strong, you're smart, and you're smiling. You're safe, you're strong, you're smart, and you're smiling. You're safe, you're strong, and smart, and smiling. You're safe, you're strong, you're smart, and smiling. You're safe, strong, smart, and smiling. You're safe, strong, smart, and smiling. And one more round of box breathing. You're safe, you're smiling, you're smiling, you're smiling. You're smiling, you're smiling, you're smiling. Good. That's it. Now, Private, wake up. I want you to tell me what for you, what was your distress number when you start out?
The number?
Of your distress.
About an 8.
An 8?
Yes.
All right, what is the number of your distress right now?
2.
Okay. So when he was playing the gunny role, we got his stress level down from 8 to 2. And that's because you guys were here setting your intent. Thank you. You're dismissed, Private.
Thank you.
Good job. Now what I didn't tell, oh, would you flip the, oh, that doesn't work very well. Oh my goodness, the Y got cut off. Oh, that's supposed to be therapy, and this word is work. What I didn't tell you, which the gunny sergeant told me, is that the Marines know there are only 5 outcomes for the go-go combat stress reaction. Only 5. The first one is the muscles go out and kill somebody, because that's what the muscles are conditioned to do. The second one is the muscles go out and commit suicide. The third one is the muscles go down to the bar, drink a lot, tear the bar apart, and they go to the jail. The fourth one is the muscles go out into the woods and stay there for 25 years because they don't want to be stimulated with any more triggers. And the fifth outcome for the go-go combat stress reaction is you go down to the hospital emergency room, they give you a huge dose of Thorazine, and you drop, and they put you in a lockdown cell for 48 hours where your body metabolizes off the sympathetic compounds. So today, Gunny would like to report to you that yes, indeed, there is a 6th outcome for the go-go combat stress reaction. And that outcome is feed me, feed me, feed me. I am starving to death. I haven't had anything to eat for 20 hours. Because what happened is that the sympathetic drive that he was on was totally switched over to parasympathetic drive, and he became acutely hungry. He actually took a gallon of water that had antioxidants in it and chugged a whole gallon of water. And that is because the Navy SEALs believe that if there's anything that's worth doing, it's worth overdoing. Yep, Marines and SEALs are pretty similar. Anyway, that gunny sergeant, he went back and he slept for 2 days straight and drank a lot of water and detoxed for 2 days. Next slide. MASER therapy is easily, this is a conclusion, the MASER therapy is easily learned by any medic, combat corpsman, pararescue, who step in and easily treat the go-go stress reaction before any collateral damage occurs. These same providers, very talented, militarily trained people, can be rapidly trained to use the FSM 10s unit. Combination of both, next slide, of both the FSM and the microcurrent can significantly impact this. A disclaimer, you know about the protocols and the pregnancy business. It is very difficult for civilians to treat the go-go because the DOD and the VA control warrior treatment options, thus limiting clinical trials even more. There is, next slide, and you have my name, and if you want to have a copy of this white paper that I wrote, it contains all these the 3 protocols, right out of the STAR box. Thank you, Ningwu. And my son's tapping protocol, which you may distribute to all the people, and it also contains a bibliography for professionals. Company is dismissed.